everyone. Good afternoon. It is around 4:15 p.m. in Saudi Arabia, and people who know me, I am Anurag Jain, and for people who don't know me, also I am Anurag Jain. I am very thankful to Dr. Marwan, who has made all this arrangement. Actually, we wanted to deliver this lecture direct on Skype, but due to technical hazards or problems, we could not complete it. And I thankful all the persons who joined us on Skype live. But sorry for that. Really, they have given their precious time to us, but we could not get through the Skype technical hitches. Now, actually, why I I got some inspiration from some academies who are giving online lectures and recorded on YouTube. So I thought that it is a good opportunity for me, especially when Dr. Marwan is there and who can handle the technical matters, to record these lectures. And if it is possible, we will try, inshallah, in future to directly have online. So today my presentation is normal periodontal tissues. Actually, I want to start basic. I know even when maybe people have already passed their graduation, but still they may refresh. Or for the students who have no teachers in periodontics, periodontics in their colleges, they can be benefited from, because today I am touching only with basics of normal periodontal tissues. Okay. See, first, this is a first slide is, this is an old dentistry. Can you see a dentist with a cord? This is an electric engine, and this is a foot engine. I have seen this foot engine. It's actually our senior batch. They were using this foot engines. Really need strong neck muscles. Now, I will come to basics of periodontal tissues. This picture shows a longitudinal section of a tooth through gingiva, alveolar bone, and pulp. So, what I will discuss today only regarding the periodontal tissues. What are normal periodontal tissue or healthy periodontal tissues? I think I will tell you what are the periodontal tissues. This is gingiva, which is shown in the pink color. This is alveolar bone, which is shown in slightly brown color. This is cementum and root, of course, and this is a periodontal space here. This is root, and this is a periodontal space. Of course, in this picture, their fibers are not visible. In other slides, we will start showing you the pictures of periodontal tissues also, periodontal ligaments. Now, periodontium. What are the functions of periodontium? The main function of periodontium is to attach a tooth to the jaw bone. Other functions of it can participate in development of teeth, and all these periodontal tissues help each other for repair, regeneration, and maintenance of each other. Like if bone is lost, gingiva will also be receded. So they try to maintain each other in cooperation with each other. Then it maintains barrier against physical and chemical and bacterial challenges. What are the physical challenges? Like pressure, like any trauma. So gingiva will protect the bone or the tooth surface, and like other physical condition can be like direct trauma from operation.
Food mastication.
Trauma from operation. The periodontal ligament will prevent, by its own nature, they will prevent trauma to the bone and the tooth itself. Now, what are the components of gingiva? Periodontal tissues, they are composed of gingiva, periodontal ligament, cementum, and alveolar bone. Now, this slide shows, first of all, this slide shows the anatomical features of gingiva. This is a tooth. This is gingiva. This is pink in color, and this is gingival margin. This is free gingival groove. This is attached gingiva. This is mucogingival junction, and this is alveolar mucosa. Now, what is free gingiva? And this is interdental gingiva. This is another picture, shows gingival sulcus, outer surface of gingiva, circular. This is the soft tissue wall of the gingival sulcus. This is alveolar bone and periodontal ligaments. This slide, longitudinal section shows gingival sulcus with the junction epithelium. You can see when the junction epithelium is near the cementum, it is very thin. At the coronal end, it is 15 to 20 cell thick. These are the epithelial retipex, and this is the enamel. Now, of course, this slide is little out of, you can say, may not be required here, but I will just show you what is biological width. These days, a lot of talking about biological width because a lot of teeth may require crown lengthening. What is biological width? It is basically the distance between the crest of the alveolar bone and the base of the sulcus. This is normally, you can see it is counted here. Total biological width is 2.4 millimeter, approximate 2.04 millimeter. This connective tissue attachment is shown here. It is around 1.07 millimeter, and junctional epithelium is 0.97. It can be made into round figures. So plus minus 2.5 millimeter is of 2.04 millimeter is considered normal, and they have taken gingival sulcus up to 0.7 mm. This is the description regarding biological width, which I have already described. Now this is another picture showing the anatomy of gingiva. It is showing marginal gingiva, free gingival groove, or gingival groove you can call, attached gingiva, and mucogingival line and alveolar mucosa. Now I will describe slightly the clinical features or the anatomy of gingiva from this picture itself. Now, what is marginal gingiva? It is the most corner part of gingiva. It surrounds the tooth surface in a collar-like fashion or a cuff-like fashion. It forms the soft tissue wall of the gingival sulcus, which I have shown you previously. This is marginal gingiva in longitudinal section. It forms the soft tissue wall of the sulcus, but sulcus it is still controversial. Ideal sulcus depth should be 0, but generally 1 to 1.5 millimeter of gingival sulcus is considered normal, but it is not ideal. So gingival sulcus is surrounded by one side on the gingiva and on the other side on the tooth surface. See, now you see gingival sulcus. See, it has two sides. One side is the tooth surface, the other side is gingiva, and it is the gingival sulcus. Normal gingival sulcus should not allow penetration of periodontal probe. Now, after marginal gingiva, there is a groove you will see on the gingival surface, on the outer surface of gingiva, but it is visible only in the 50% cases.
Why is that?
Because this is anatomic variation.
Anatomic variation? But it's normal.
It's normal. It is normal also. Even if you don't see free gingival groove on the outer surface of gingiva, it can be normal also. Then this free gingival groove can be corresponded to the base of the sulcus. See, this free gingival groove can be corresponded sometimes to the base of the sulcus or the CE junction. Now, after this free gingival groove is attached gingiva. It is that part of gingiva which is firmly attached to the tooth surface and alveolar bone with the help of fibers. What is the function of attached gingiva? It is basically keratinized, and it is also called as masticatory mucosa because it bears the load of forces of mastication, tooth brushing, or any other trauma. Since it is keratinized, it will not even bleed easily also. After this, there is another scallop line you will see. It is known as mucogingival junction, which separates the attached gingiva from alveolar mucosa. Mucogingival junction is again a scalloped line. It is it separates from alveolar mucosa. Alveolar mucosa is non-keratinized. It is it is more red in color because it is more vascular than the attached gingiva. Now, one thing I forgot to tell you that even the gingival margin is scallop shape. It is not a straight line. In subsequent slides, I will tell you about it. Now, in outer surface of gingiva, you will see the surface of tooth. Here, this is marginal gingiva, and this is interdental papilla. Now, how interdental papilla is formed? This interdental papilla is formed by joining of the facial and lingual gingiva, and it is a horse saddle shape or sagging tent shape depression just apical to the contact area of the tooth, to two adjacent teeth. I'll show you in subsequent slides about that also. See, this is a slide which shows the exact picture of contact area between two adjacent teeth. This is facial gingiva, this is lingual gingiva, and this is cone. This is part of interdental gingiva. Cone is generally non-keratinized, and it is supposed that it is the place from where this periodontal disease starts. You can notice that this is sagging from here because of presence of now, but coal will be absent. See, this is contact area, this is coal. But coal will be absent in those teeth which have no contact areas or they have recession. You can see here, this coal is absent and it is in the shape of pyramid. It is called pyramidal shape. Now you can see I have given a picture of horse saddle to differentiate it. It is shape of horse saddle or of a sagging tent. You put a big stone on the tent and you will find a concavity. This will form like that. Now I think I have already described this through the picture. Should I describe it again?
Marginal gingiva?
No.
That's up to you.
No. If you think that it is
it's very clear.
clear from the previous presentation. Yes.
Many times you
Yes.
read it.
Free gingival groove I have told already. Attached gingiva.
You thought about it.
Told already. Mucogingival junction also. Components of gingiva, I will first name it here, then I will show you a slide. Oral and circular epithelium, dentogingival junction, junctional epithelium, and lamina propria. Lamina propria also known as connective tissue part of the gingiva. Now we will go to the slide in the beginning itself, in which I had shown you a longitudinal section. This is what I told you is components of gingiva. This is marginal gingiva, yes, oral and circular epithelium. This is oral epithelium, this is circular epithelium, which is part of the gingival sulcus. Then there is dentogingival junction and junctional epithelium. This is junctional epithelium. This is very visible, this is very clear from here. This is dentogingival junction, this is junctional epithelium, and lamina propria is the connective tissue part of gingiva. This is all lamina propria. Okay, I will discuss in short each part of. This is oral epithelium. This is stratified. Of course, all parts of epithelium in the oral mucosa are stratified squamous epithelium. This is outer surface. In health, it is keratinized. The circular epithelium generally is supposed to be non-keratinized, but if a person is maintaining very good oral hygiene, it will also get keratinized. This is junctional epithelium. It is 15 to 20 cell width here in the coronal part and 1 cell width in the apical part. This junctional epithelium and tooth surface and the attachment along with the gingival fibers, and this is called as dentogingival unit, or it is considered as one unit. Now I will describe a little bit about the epithelium. Gingival epithelium generally consists of only stratified, this is larger part of gingival epithelium is composed of stratified squamous epithelium. But there are some other cells also seen in the epithelial tissues, which are melanocytes, which secrete melanin pigment, give darker color to the gingiva. Then there are modified lysosomes in some of the epithelial cells. These are for defense mechanism. This is also known as ordinate bodies. Then you have monocyte in the tissue. They are part of the actually epithelial tissue. They don't come from the connective tissue or the blood. They are known as Langerhans cells, and there are nerve endings in the epithelial tissue which they differentiate from the stem cells as Merkel cells. They are nerve endings. Now this is a picture shows different parts of squamous cell epithelium. This is stratum basale, basal cell layer, spinous cell layer, granular cell layer, and this is corneal layer. Actually, this is corneal layer is generally in attached gingiva. It is keratinized. 70% of the mucosa, keratinized mucosa consists of parakeratin. That means this the epithelial cells consist of pycnotic nuclei and some organelle. 30% of epithelium they may consist of orthokeratin. Orthokeratinized. The orthokeratinized mucosa will not have any cell or organelle.